Xdemvy 0.25% eye drops are used to treat a parasitic infection of the eye called Demodex blepharitis, which can affect the eyelids. It belongs to a class of drugs known as antiparasitics and works by killing parasites. This medication is specifically for treating parasitic eye infections and will not work for other types of eye infections. The recommended dosage for adults is 1 drop in the affected eye once a day, usually in the evening before bedtime. It is important to follow the instructions provided by your doctor and to continue using the medication for the full prescribed length of time, even if symptoms improve. If you have any concerns or questions about this medication, be sure to consult with your healthcare provider. To use Xdemvy 0.25% eye drops, wash your hands first to avoid contamination. If you wear contact lenses, remove them before using the eye drops and wait at least 15 minutes before putting them back in. Tilt your head back, look upward, and pull down the lower eyelid to create a pouch. Hold the dropper directly over your eye and place 1 drop into the pouch. Close your eyes and apply gentle pressure for 1 to 2 minutes to prevent the medication from draining out. Try not to blink or rub your eye. If you need to use the medication in both eyes, repeat these steps for the other eye. Do not rinse the dropper and replace the cap after each use. If you are using other eye medications, wait at least 5 minutes before applying Xdemvy 0.25% eye drops. Use this medication regularly at the same times each day to get the most benefit from it. Continue using it for the full time prescribed, even if your symptoms disappear. Stopping the medication too early may result in a return of the infection. If your condition lasts or gets worse, be sure to tell your doctor. If you experience eye discomfort, stinging, or burning, it's important to let your doctor or pharmacist know. This medication has been prescribed to you because your doctor believes that the benefits outweigh the risks of potential side effects. Most people using this medication do not experience serious side effects, but it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. Keep in mind that this is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. Before using Xdemvy 0.25% eye drops, it's important to talk to your doctor or pharmacist if you have any allergies, as this product may contain inactive ingredients that can cause allergic reactions. It's also important to discuss your medical history with your healthcare provider before using this medication. If you develop another eye infection or injury, or if you have eye surgery, make sure to ask your doctor if you should continue to use this medication. After applying Xdemvy 0.25% eye drops, your vision may become temporarily blurred, so it's important to avoid driving, using machinery, or doing any activities that require clear vision until your vision has cleared. Before having surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, you should only use this medication when clearly needed and discuss the risks and benefits with your doctor. It is also important to consult your doctor before using this medication while breastfeeding. When using Xdemvy 0.25% eye drops, it's important to be aware of any potential drug interactions that could affect how the medication works or increase the risk of serious side effects. To minimize this risk, keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without first consulting with your doctor. This will help ensure the safe and effective use of Xdemvy 0.25% eye drops. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 or a poison control center right away. In the U.S., you can reach the local poison control center at 1-800-222-1222, and in Canada, you can contact a provincial poison control center. Remember, it's important to keep this medication out of reach of children at all times. It is important not to share Xdemvy 0.25% eye drops with others. This medication has been prescribed specifically for your current condition, so it should not be used for any other infection unless instructed by your doctor. If you forget to use a dose of Xdemvy 0.25% eye drops, just use the next dose at your usual time. Do not use extra to make up for the missed dose. These eye drops should be stored at room temperature, away from light and moisture. Avoid storing them in the bathroom and keep them out of reach of children and pets. When you no longer need the eye drops or they have expired, make sure to properly discard them. You can consult your pharmacist or local waste disposal company for the best way to do this. Avoid flushing the medication down the toilet or pouring it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.